Thank you for standing with us here tonight at the North Carolina General Assembly. We gather on the symbolic ground from remembrance to resistance. To remember the lives lost because care came too late, and to resist the policies that continue to put profits and their interests over people. Behind every number and every policy debate are real families. Mothers, fathers, grandparents, and children who should still be here today. Who lost their lives because they were denied access to care, denied the chance to heal, denied their basic human right to live with dignity. As the state prepares to cut healthcare access in January, we lift up the voices of North Carolinians, specifically North Carolinian Latina families, who have carried the pain of loss, but also the courage to speak truth to power. Their stories are a call to action. Their grief fuels our resistance. Through the work of Somos Loving, a statewide communications coalition made up of Latina organizations working together to engage and mobilize Latina communities across North Carolina, we're honored to be joined by speakers who represent the heart of this land. Band members who lost loved ones, healthcare providers who put illness and human toll every day, community leaders and policy experts working tirelessly every day towards solutions. Thank you all for lending your voices and bringing courage to this moment. Their stories remind us that behind every policy decision are real lives, real families, and real consequences. I'd like to welcome our recommended speakers. First, please welcome Daisy Rebecca, an MC Latina resident and Medicaid.
My name is Daisy Rebecca, and I am a daughter of immigrants. My parents came to the United States from a war-torn Ecuador to build a brighter and safer future for themselves and a future family. From the moment they left El Salvador, every decision was made to ensure they could provide the best outcomes for their family. In 2009, my parents' dream came true. They had all three of their kids graduate high school and attend college. That year, I began my first year at NC State, bright-eyed and Vigilia, ready to hit the ground running. When I graduated in 2013, I was hopeful, as we all are, that this is the beginning of being able to fulfill my own American dream, to be successful and to not have the same worries as my parents did. However, that dream quickly became a nightmare. In 2018, I lost my job. I was left mentally and emotionally burned out with crippling anxiety and depression. I could no longer function, and I knew going back to full-time work wasn't an option. Thankfully, at the time, I had a therapist who understood my situation and worked with me to find a way to pay for sessions and get my medication covered. At the end of that year, I was able to apply to the Affordable Care Act, Obamacare, where I was able to get subsidies to be able to afford to continue therapy and the medications I needed. As I continued this journey to manage my mental health in 2022, thanks to bad policy written by Republicans, I had no insurance because somehow I was too poor to qualify for subsidies anymore and too young with no children to qualify for Medicaid. Again, thankfully, I had a therapist who worked with me to be able to pay for sessions. In 2023, thanks to the Medicaid expansion in North Carolina, I was able to be covered again. I could afford my medication, and I was able to get the medical attention I needed. I found a great doctor and nurse that had helped me address my additional medical concerns. If it wasn't for the nurse getting me in a doctor's appointment the next day after I voiced the concern, I wouldn't have known I needed to go to the ER for emergency surgery. Now in 2025, the government continues to play with our livelihood. In September, I received the wonderful news that I am pregnant with my first child. Being self-employed means that weeks and months can be very unpredictable. I am either making just enough for the month, or I am trying to figure out the best way to stretch my dollars. So I signed up immediately for SNAP and WIC to ensure some stability in accessing nutritious food for myself and my growing baby. However, in November, those benefits will be stopped, and I again will have to scramble and figure out how to best navigate the situation. The ACA and Medicaid have literally saved my life multiple times. SNAP and WIC were providing some peace in an otherwise chaotic life. So no, we do not take Medicaid away from an illegal immigrant. We are not withholding food from a lazy, unemployed immigrant. We took it away from a United States citizen who's been battling her mental health for years, who's done everything the right way.
Thank you so much, Daisy, for those remarks. Next we have Tania Trejo Mendez, Race Coordinator with Planned Parenthood South Atlantic.
Hi everyone. Thank you all for being here today. My name is Tania Trejo Mendez and I am the Latina Community Organizer for our RISE program at Planned Parenthood South Atlantic. I'm here today to make plain the impact that recent cuts to Medicaid will have on North Carolina as a whole and on patients at Planned Parenthood who can no longer use their Medicaid to seek essential preventative care at our health centers. First, let me start off by plainly and clearly stating every person should be able to access quality, affordable health care from a provider they trust, no matter their income or insurance status. It's a value that our organization stands by and one that I hold deeply as well. I came into my work at Planned Parenthood because I know what it's like to struggle for accessible and affordable health care. I grew up in a Mexican working class family where health care wasn't guaranteed. We relied on free or low-cost Canadian clinics and whatever my Medicaid coverage would allow. But even with that support, the care wasn't easy to get. Language barriers and feeling unwelcome in many spaces were just more barriers to care that we had to navigate. These experiences taught me that access to care shouldn't depend on luck or on income. Access to healthcare is a basic human right. Because of my story, I can empathize deeply with the struggle that thousands of North Carolinians are facing now due to the recent attacks on Medicaid, both in Congress and in our own state legislature. Medicaid is a cornerstone of our American healthcare system. 1 in 5 Americans rely on Medicaid for their healthcare coverage, and that number is even larger in North Carolina, climbing to 1 in 4. But many of our friends, neighbors, and loved ones could see their rates dramatically increase or lose their coverage altogether because of staggering funding cuts that Congress continues to push at the national level. It's predicted that over the next decade, more than 8 million Americans will lose their Medicaid coverage because of President Trump's big, beautiful bill, meaning that millions of people who have come to depend on Medicaid to access everything from emergency care, routine preventative care, and primary care will have lost that access. It's devastating and cruel in ways that I can't even fully put into words, and we know that this is especially true for members of our Latina communities who already disproportionately face challenges and stigma in our healthcare system. As a provider, we are already seeing how the changes in the bill are impacting people's ability to seek affordable care. An additional provision in this bill specifically impacts patients' ability to use their Medicaid at Planned Parenthood South Atlantic and the Planned Parenthood health care centers across the country. And as of September 11th, that provision is in effect. Over the past several weeks, we've received countless messages from patients who are scared, confused, and angry, and I don't blame them. Patients are telling us that for the longest time, we have been the only affordable option for that health care, and now that we are unable to see them using their Medicaid, they may have to delay care and seek it elsewhere, or discontinue it altogether. This means that cancers will go undetected, STIs will go untreated, birth control will be harder to get, and the public health infrastructure of communities will break down. So I want to make one thing clear. When you hear politicians who pass these bills try to depersonalize Medicaid or say that they're acting to defund Planned Parenthood, they are lying about the true harm that they are causing. What they're really doing is taking away access to affordable health care that people depend on. They are making things harder instead of helping people. Moving forward, we are continuing to explore all of our options to keep our doors open to all patients, including those with Medicaid coverage. We will never back down, and we will continue to fight for affordable health care and access for our patients. And it gives me strength to know that we are not alone in this fight. Thank you all so much for being here.
Thank you for sharing your informative experience with us, Tania. Next we have Sandine Santiago Lopez, Community Building Coordinator at NC Budget and Tax Center.
Good morning, everyone. I'm Celine Santiago Lopez from the NC Budget and Tax Center. No matter what we look like or where we live, we all want the same things: to care for our families and see our communities thrive. We stand on the shoulders of those who built the groundwork to make North Carolina a place of opportunity for everyone. But right now, we're seeing powerful lawmakers rig the tax code to benefit corporations and the wealthiest among us, while the rest of us struggle with rising costs and barriers to basic necessities like healthcare access. The harmful federal bill slashed funding for Medicaid and SNAP, programs that hundreds and thousands of North Carolinians rely on just to get by. Meanwhile, Congress is engaged in a standoff about whether or not to extend Affordable Care Act tax credits that help people afford the care they need to stay healthy. With these credits expiring, premium prices could double for many enrollees, possibly leading to many North Carolinians going without needed healthcare in the coming months. In addition, SNAP benefits could run out in 2 days because the federal administration is refusing to transfer funds during the shutdown. Over 1.4 million North Carolinians could see their grocery costs skyrocket and risk having no food on their tables. And instead of state lawmakers stepping in to protect us from these disastrous funding cuts, they continue to cater to corporations and the richest 1%, showering them with tax breaks that have been in motion since 2013. Due to these tax cuts, North Carolina is losing almost $18 billion in revenue each year. That's billions of dollars we could use to make healthcare more affordable for families, help put food table on the tables, and invest in public resources that help keep costs down for everyone. Not to mention, we just had a legislative session come and go without lawmakers passing a state budget that could fully fund Medicaid, make childcare more accessible and affordable, and fund our public schools so every child gets the great education they deserve. Together, we have the power to demand a state budget that puts people first, one that's rooted in well-being and transparency, one that funds what our families and friends need, and one that does not ask the most from those suffering the most from these economic choices. Let's honor those who are no longer with us by fighting for a better future for all of us here. We must demand that state lawmakers stop reckless tax cuts for big corporations and the rich so we can fund a future we all deserve. Thank you.
Thank you so much, Celine, for your remarks. Next we have Dr. Andrea Casanes, nurse, researcher, and health justice advocate.
I wish I could say good morning, but it certainly isn't when families across North Carolina are forced to choose between medicine and rent, between a doctor's visit and putting food on table. My name is Doctora Andrea Casales. During COVID, I was one of the essential workers you called a hero. While others stayed at home, I spent long shifts caring for the tiniest but mightiest newborns and supporting their families. And when I wasn't at the hospital, I was working toward my PhD to study how to make our communities healthier and stronger. That's what showing up looks like. Even today, I can't fully show up for my patients when their health care is being stripped away and when families who look like mine are being attacked at work, in their neighborhoods, and at home. It makes it that much harder for me to do the work I've always loved, to care for others. When you cut Medicaid, you're not cutting a line in a budget. You're cutting the lifeline that keeps millions of people alive. That's 3 million in North Carolina. As we celebrate Dia de los Muertos, families build ofrendas, altars filled with marigolds, candles, food, and photos to welcome and remember the loved ones who have passed. But I also want to say this clearly. I do not want to keep adding names to the ofrenda when their deaths could have been 100% preventable. Dia de los Muertos reminds us that when we honor those that have been lost, we honor them by fighting for the living. And we honor them by fighting fiercely to make sure that healthcare is a human right. And let's be honest, there is money. The problem isn't scarcity, it's priorities. The ICE budget has tripled, yet the very programs that keep families alive are being cut. Billions have been invested in detention instead of prevention, in punishment instead of care. If there's enough money to separate families and for genocides, then there's more than enough to keep them connected, whole, and alive. Meanwhile, the North Carolina General Assembly still hasn't passed a comprehensive state budget, finding time to draw new district lines to protect the power of the ultra-wealthy and greedy corporations, but not protect people's lives. That's an attack. Healthcare can't wait. When care is delayed, lives are lost. When families lose coverage, we all pay the price. And when politicians put profit over people, they betray the very oath out of public office. You make it harder every single day for essential workers like me to do our jobs. What happened to thank your essential workers? Well, this essential worker wants families to stay healthy. This essential worker wants children to grow up with parents who can afford care. This essential worker knows that an attack on Medicaid is an attack on every working family in this state. And this is not just about what we're against, it's about what we're fighting for. A North Carolina where families can stay whole, where healthcare protects all, and where every child truly has the chance to thrive. In North Carolina where families can trust their elected officials who work for them to put the people first and stand with them, not profit. Where healthcare is treated as the human right that it is because it is a lifeline and it cannot wait. And together, we're going to make that happen. The question is, will you stand with the people or with profit? Lastly, el pueblo unido jamás será vencido. The people united will never be defeated.
Thank you so much, Dr. Andrea Gonzalez, for sharing your expertise with us. Finally, we have Vigilia Santillan, Prada and Z, Executive Director.
When I look at this altar, I'm reminded of who we are, a people of memory, resilience, and deep love. This ofrenda that you see right here is not about mourning, it's about honoring our ancestry and the strength that has been passed down to us. Because no matter how many times our leaders fail us, our people will always find a way to keep going. We know how to turn struggle into courage and culture into resistance. I'm Liliana Santillan, founder and executive director of Brava, North Carolina, and I am tired of seeing our communities treated like pawns in a political game. Our families keep this state running, yet the people in power refuse to do their jobs. Healthcare in North Carolina is in crisis. 3 million North Carolinians rely on Medicaid. That's 37% of all births, 60% of nursing home care, and over 1 million children. And still, our elected officials can't pass a full budget or protect the programs that literally keep people alive. Instead of doing the right thing, they've gerrymandered our districts and put politics over people. And that's not leadership, that's cowardice. And that cowardice has consequences. Because Washington refused to extend Affordable Care Act credits, the average North Carolinian will pay $672 more next year for the same health care plan. That's groceries, that's rent, and that's survival. Meanwhile, the ultra-wealthy get tax breaks, and the people who make the state work, nurses, teachers, farm workers, small business owners, are left behind. When our elders can't afford nursing homes, when children can't learn because their health needs go unmet, that's not just bad policy, that's betrayal on the very future of North Carolina. By refusing to expand and protect healthcare, our leaders are weakening the foundation of our state, the health, the dignity, and the potential of our communities. But we will not fail each other. We are survivors and we don't give up. We know how to organize, how to show up, and how to stand together across differences, across race, gender, status, and label. Because when we stand united, there is nothing they can take from us. Our strength lies in community, and community is what will save us. I see that power in leaders like Dr. Andrea Gonzalez, who just spoke, a nurse and advocate who had the courage to run for office because she refuses to stay silent while her patients suffer. That's what hope looks like in action. I urge y'all to keep calling your legislators, keep telling your stories, keep showing up, but also vote in every single election. Local elections, school boards, county seats, the legislature, every one of them matters because in 2026, we have a chance to change the direction of this state, to elect leaders who will stand up for us instead of selling us out. Because healthcare can't
pidieron
wait,
como el
we
apoyo,
can't
vamos a
wait,
cambiar.
and we won't.
O el otro puede esperar.
Thank you so much, Juliana, for ending us in such a
Desde
powerful
aquí se van
message.
adentro.
As we close today, we carry the stories shared today in our hearts. Stories of grief, resilience, and unwavering love for our communities. To our speakers, thank you for your courage, your honesty, your leadership. You reminded us that this fight is not abstract, it's deeply personal. To everyone here, and to those listening beyond these steps, we refuse to accept a North Carolina where families must choose between medicine and food, or where access to care depends on your job, your income, or your immigration status. Lawmakers inside this building must understand these are life and death decisions, and we will continue to show up, organize, and demand justice until every person in our state can get the care they deserve. From remembrance to resistance, we move forward together because healthcare can't wait, and neither can we.